Good morning and welcome to another edition of the VDA Live Presents. And we've got with us today His Excellency, the Governor of Virginia, Dr. Ralph Northam. So thankful for you to join us today. I know we had some issues yesterday, and technology is a wonderful thing when it works, and when it doesn't, it is not. So thank you again for being with us. And we've also got our president of the Virginia Dental Association this year, is Dr. Elizabeth Reynolds, joining us. And Dr. Reynolds is going to run through some questions that we've gotten from members. And we had a lot of questions, which, you know and are familiar that that is the time we're in. Everybody is got a lot of questions, and nobody's been through something like this before. We're also very excited to have Dr. Carey with us, who will be able to weigh in when the governor sees fit and offer some insight as well. So with that, Governor, if you'd like to say a few words and get us started, and then we'll get some questions going.
Well, thanks, Ryan and Elizabeth, and we really appreciate the opportunity to be with you this morning. And again, your input is just so valuable to us. So we hopefully we'll be able to answer your questions. But I think a lot of the discussion this morning needs to really center around how we move forward, how we kind of put this crisis behind us, how we get you all back into your offices, patients back into your dental chair, and also how we make sure that our patients feel comfortable coming back and assure them that it's safe to do so. So we'll kind of talk about some of those things. I wanted to thank you all for what you do. As you know, Dan and I are both physicians, but we don't know a whole lot about dentistry, but we appreciate your all that you contribute to the healthcare and well-being of Virginians, and also please extend our thanks to your staff, your dental assistants, your hygienists, your office staff for being patient and really being part of the solution here. And this, we're in a health crisis right now, the likes of which I don't think any of us ever experienced. We're also in an economic crisis. Businesses have been shut down. People are out of work, can't pay bills, etc. So it's a tough time, and a lot of Virginians are making sacrifices. And so the sooner that we can work together and put this health crisis behind us, the sooner we can get our economy back up and running and let people return to their normal lives. So we thank you all for all you do. We have taken some fairly aggressive measures, as you know, to minimize the spread of this virus. We shut down our schools. We have asked hospitals, we've asked healthcare providers to refrain from doing elective procedures and surgeries. We have a stay-at-home order through June the 10th, and that's not written in stone, but we were trying to be consistent with our emergency declaration with that time. We've also worked very hard with our hospitals to make sure that they have the bed capacity if and when we have a surge of patients coming to their facilities. Staffing has been something that we have paid a lot of attention to. We want to keep everybody healthy and safe. We've had I think over 17,000 individuals now volunteer through our medical corps, which is really commendable, I think, for Virginians to do that. The ongoing saga of PPE, we can talk about that a little bit today if you're interested. We started basically with, I remind people, we're fighting a biological war with no supplies, and that's the way this started. Our first patient, as you all probably remember, our first positive was on March the 7th. And regarding PPE, it's getting better every day. We've ordered a shipment from overseas. We got the first part of that shipment a few days ago. It looks good. It's just what we need. So we're continuing to ramp up PPE, not only for what we're dealing with now, but should we have a second wave, God forbid, we want to be prepared for that as well. So I'd love to hear from you all where we are with PPE for you and your staff. And then the other challenge, let me just say, with PPE and also with testing, because we haven't had a whole lot of direction from Washington, governors, healthcare systems, countries. We've been competing for the same supply, so it's been a very, very chaotic process, but we're making progress, I think. And so I was going to talk about the testing as well. That hadn't been a perfect science either, and a lot of it has been in supplies. A lot of it has been, it's been so cumbersome. The turnaround time has been so long that a lot of providers have chosen just to make clinical diagnoses. So we formed a task group. Dr. Karen Remley, who was our former Commissioner of Health, and also Dr. Lillian Peak, who is in the Department of Health, are working on that. And every day is better. We're testing between 2,000 and 3,000 individuals a day. Our goal is to get up to 10,000 in order to start to be able to ease some of these restrictions and again make or allow our consumers to feel safe coming into businesses as we reopen them. Just a quick comment about our budget. We had a great budget 4 weeks ago, but times have changed and the legislature is here today. We've done what we call an unallotment, where we've basically hit the pause button. We'll see how our revenue is doing in a couple months and do a reforecast, and then they'll probably come back for a special session to deal with some of the priorities that we have in Virginia. And then the last topic, just very briefly, which is not perfect science as well, is the different models and data that we're using to really map out when we think the peak or the surge will be. And that changes by the hour and by the day. We're looking right in this time frame in the next few days as being the peak. We had 3 days of trending numbers that were going down a bit, or at least they weren't rising as quickly as they were. Then yesterday we had over 600 new cases, 24 additional deaths. So we're watching that closely, but we haven't kind of come off the backside of that curve yet. So that's a lot of information. Tough decisions being made, but we want to get your profession up and running as soon as we can. And I really would love to hear your input as far as where you are, how you're feeling about, starting back up. Do you have the PPE you need, the testing capabilities, et cetera. So that's probably more than you all needed to hear, Ryan and Elizabeth and all the others that are watching. But again, this is a team effort. We don't have a monopoly on ideas here, and we really appreciate you taking time, and we appreciate your input. So I'll turn it back to you, and then we'll try to work through some of these questions.
Thank you so much, Governor. On behalf of the VDA, we really do appreciate your taking the time to be with us. I know that it is a crazy time for you. Again, to our members, I'm sorry things didn't work out yesterday. I think people were so excited to see the governor that we broke the internet. So we're going to try this in a little different plan this time. You touched on a lot of the questions we have for you, Governor. I guess one of the things I will say is that I do feel that that dentistry has played a pivotal role in the COVID-19 crisis. We were the first group to self-regulate and recommend only emergency treatment. We, as you mentioned, have been selflessly donating our PPE. We also have stepped up and joined your medical corps, which I'm very excited, the Medical Reserve Corps. And then we continue to help out, I think, by seeing our emergency patients to keep them out of the hospital system, which is where I am today, as you can see, in my scrubs, not in my fancy outfit that I would prefer to be interviewing the governor in, but that's where we are. I guess if we take these a little bit one at a time, and maybe we can just have a discussion about them. The first thing that I think you had talked about was PPE. As I said, we have been donating our PPE, and so a lot of our supplies are depleted. Are you considering putting us on the PPE chain so that we can get up and get back, because we need it not only for our non-emergent care, but for our emergent care?
Elizabeth, absolutely. And while we're not inundated with PPE, we're getting more supply every day. And to your point, thanks so much for helping conserve and also contributing to other causes. So yes, Dan, do you want to comment on this? If they need PPE, how to make that happen? You come on around here so they can.
Well, I want to keep my distance as well. Good to see you all.
Hey, Dr. Carey.
let me bring a couple of tools with me just so I have some data, and I'll peek my head around the corner. Well, good to see you all, and what an honor it is to be with your membership. I'll simply say it, during my time as a clinical cardiologist in Lynchburg, I had the great honor to be the liaison to the dental community, oral health community, because of for both anticoagulation issues, as you know, come into play, as well as in preventing bacterial endocarditis. So it was a great opportunity for me to stay in touch with the dental community in Lynchburg. So I've always, and also inflammation issues in the mouth, as you know, can promote atherosclerosis and inflammation. So a very important connection with my practice in the past. So back to PPE. I will simply say that the state has aggressively entered into the market in order to purchase protective equipment, face shields, procedural masks, N95 masks, non-sterile gloves, in addition to coveralls. We are in the market just like health systems and individual practices are. We have a supply chain, there's a distribution chain. We have shipments that are coming in from China, and that we put $27 million order. We've received about a third of that. And we distribute that through two mechanisms. One is through the Virginia Hospital and Healthcare Association has a regional healthcare coalitions, and a fraction goes to them to distribute. That includes long-term care facilities, primarily nursing homes in their region. And the other portion goes to the health department, who's in touch with local providers to see where the gaps are, whether it's localities and their EMS personnel, whether it's an independent practice, whether an oral medicine, oral surgery, or dentistry practice, or really departments of social services that need to go into home, and the AAAs and the Department of the Aging and Rehabilitative Service do adult protective and child protective service. They go in the home, and just like other first responders, they need to have at least a mask and gloves. So my recommendation is, if your practices are not able to get what you need, then the first call should be to your local health department to make sure that that need is known and it's communicated to the emergency management system. But I think we would be misrepresenting the capacity if we were to say we could supply through state efforts the complete PPE needs of individual providers, individual emergency first responders, as well as the health systems. We can supplement where there are gaps, and we don't. The other mechanism was to distribute what was available through the national stockpile. That has been fully depleted, so that does not exist. So we are aggressively going after it. If your practices do not have it and you're unable to order it, then please let your local health department know so that they can put you all in that, that we understand those needs and can better fill those needs. So I hope that was a long-winded answer. I hope it answered your question adequately.
Elizabeth, how are you all doing with your supply chains of the obviously the gowns and the gloves and the things that you need? Do you find that you're able to get some of those supplies? The reason I asked, we're having this discussion with our hospitals. Obviously, PPEs can be different from what you use in the OR when we talk about, opening back up for elective surgery. So if you could kind of give us a feel for, for how things are going in your world, that would be helpful as well.
We are just starting to try to get our supply chain back together. My understanding from the suppliers is that all of their PPE was diverted to medical. Okay. So we haven't been able to get anything from that way and up until now. They're starting to divert some of it back to dental. We had a discussion about this just last night on one of my conference calls. We're really trying to figure out a way to put that supply chain back together, okay, to make sure that everybody has adequate PPE to safely see, especially the emergency patients, because those right now we don't know who is a carrier, who isn't a carrier. Testing situation, as you mentioned earlier, is difficult. So we're working on getting our supply chain together, but any help that you can provide, and thank you, Dr. Carey, that certainly helps us out with some opportunities to maybe get PPE to some of our folks, maybe in rural areas that don't have the PPE that they need.
Right, right. And I think that idea of, well, I think, again, that conversation with your local health department is a great first step. If practitioners, especially for emergency cases, don't have what they need to take care of that very, very important need.
You know, Elizabeth, while we're kind of on this, and I don't want to get out of order with your questions, but maybe we could talk about the testing and if you have a patient, that how you're going to screen those patients, and if they need to be tested, where they need to go, how we need to get the results. That I can only imagine that. I mean, Dan and I both have run medical groups as well. So have you all thought through that process? And I know it's different depending on what region you're in, but we can try to help kind of smooth that process as well as we move forward.
Thank you very much. I think it would be very helpful to work through that process. We know that you've opened up that task force, and we would love to be represented on that task force. I think that we have medical professionals that are absolutely able to help with testing and eventually, hopefully, with vaccines. And as of now, what we're doing is we are focusing basically on taking temperatures, the questions that we ask on the phone. We are taking all precautions that we have for patients. If anyone presents that potentially we have a fever, you know, we have a certain range of temperature. If anybody presents, we will ask them to either go get tested or to wait 2 weeks in quarantine and see what happens. As testing becomes available, obviously that will make a very big difference for us. Aerosols are our life. And that is a really important thing. I worry about my colleagues. I worry about my team. I worry about my patients. I worry about their families. So we really are making an effort to do our screening process appropriately. And we would love to be a part of the testing once you figure out how you're going to manage that from your end.
And I believe, Dr. Reynolds, you emailed us and we connected you to the testing group. I believe so in the last 24 hours. But if not, if I'm misremembering that, please let me know. And I will also say that what you're doing now is still going to need to be done in the future, because most of Virginians, as we come off this peak and hopefully settle down in the next couple weeks and then into the months, that most folks in Virginia will not have been exposed, likely. We'll know that by some point prevalence testing that the Department of Health is designing. But you're still going to need to see, do you have a fever? Do you have symptoms? Because most folks will, a test is a point in time, and they could turn positive, 48 hours from now, even before they're symptomatic. So, testing everybody everywhere until we know that there's an antibody test that may confer, hey, the problem with antibody testing is it's qualitative, not quantitative currently. We don't really know what it means, except they were likely exposed. And because it still cross-reacts with other coronaviruses, it's not specific. So it could add as much heat than light to the situation, but that will evolve. In 6 weeks, I bet we have dramatically different testing environment. We need to integrate that into what you're already doing. So all of that was to say, testing is important, but it's not going to supplant your screening that you're doing that makes an important difference.
Yes, sir, I do understand that. Thank you for that. I guess that we could move on. I don't know how we want to, whatever order you want to do your questions in, Governor. I think that just having Dr. Carey there was a good introduction to talk about kind of overall, we really all understand how important oral health is in overall health. And we are concerned about how long we can delay treatment. As you know, a treatment procedure that is non-emergent can quickly become urgent or even emergent over time if it continues to be delayed. For this reason, we are working with, the VDA is working together with the ADA and the CDC to establish a template and some guidelines for reentry into dentistry and into non-emergent care. That said, we want to make sure that we're protecting the health and the safety of our patients and our teams. Your order of public health emergency number 2 is due to expire on April 24th. Can you speak to, is that still your plan? What criteria are you using to kind of establish that plan?
This, I'll try to make a long-winded answer short. Obviously, we want to make sure that our hospitals and our dental offices all have the equipment that they need, the PPE, the testing. I think we've already covered both of those. We're also following the CDC guidelines as best we can. Those came out on Thursday and said that they would like to see 14 days of declining numbers, and we haven't gotten there yet. So we've had discussions with our hospitals, and I appreciate the discussion today. We're going to need to extend that order for how long we haven't determined, but I would say right now for at least a week. And I'm doing that, or will be doing that, to give people the opportunity to prepare that when we do say it's okay, that you'll be ready with all of the things that we've talked about. So we're not going to, give the green light this week, but I would hope next week. But again, it's so difficult to determine what this virus is going to do from one day to the next. A couple other things I will say: the executive order for businesses, non-essential businesses, goes through May the 8th, which would be 2 weeks from Friday. So we want to be consistent with our businesses, but we realize healthcare is different, and so that's why we're going to probably look at a week rather than 2 weeks. But again, we haven't made that ultimate decision. The other, there's other considerations. We're working with our neighboring states, obviously North Carolina to our south, and Maryland and Washington to our north. And while each region's a little bit different, we're trying to be consistent with our other states. So a lot of factors are going into making the decisions. But I think we're looking at least another week before you all are up and running. And if you have different thoughts or want it to be shorter or longer or whatever, please let us know where you are on that as well, because that's very helpful to us in order to make these decisions. Dan, you?
No, I think you're exactly right, and I would say that one of the things that we're looking forward to is exactly the recommendations from a dental practitioner's perspective, exactly the guidance that comes from CDC in collaboration with the American Dental Association. We realize that dental practices, because of the inherent aerosolization, is in a particularly high-risk environment, and how to manage that really should be a national initiative. And we're so glad that those teams are working together. And at VDH and here in Virginia, we intend to follow those recommendations. And I would also say in terms of a good document to guide the opening of medical procedures that aren't urgent or emergent is really the document that I'd recommend you take a look at. It's not specific to dentistry, but good principles coming from the American College of Surgery, the American Hospital Association, the Association of Perioperative Nursing, as well as the anesthesia group. Again, we do expect the group you mentioned to come up with the best guidelines, and that we will support those, but there are also some good principles about what needs to be present to start procedures again. And I think I would recommend that for your review.
And Elizabeth, just one more thing. People have asked, well, can we open up one region sooner than the other? And obviously, this virus, the numbers have been in the denser areas of Virginia, but it doesn't know county borders and state borders. So I try to be consistent as we move forward for all of Virginia, rather than say, well, it's okay for you to start, but not you. So that's another thing that's gone into the decision making.
Thank you for that. And thank you, Dr. Carey. We'll certainly take a look at that document, and we'll be happy to get those recommendations to you all
That
as
would be
soon as
great.
we have them finalized.
Terrific.
So thank you for that. Kind of along that line, and a little bit different from what we talked about earlier, I know the Virginia Dental Association, the Medical Society of Virginia, Virginia Hospitals and Healthcare Association, and other associations representing healthcare workers have written to your office asking for an executive action to protect healthcare providers that are acting in good faith. Doing so will enable dentists and other providers to focus on the difficult task of taking care of those COVID-19 patients without the fear of legal retribution. Have you all looked into this and any other measures to protect our healthcare providers?
You want to talk about it?
Sure, and that is, we have received those letters from numerous parties and coalitions of parties, even from the trial lawyers as well. The Governor's Council is actively reviewing those and discussing with groups, as have I, and we are working through what that might look like to make sure that we provide peace of mind to the providers during really an unprecedented environment, but at the same time, the original recommendation was fairly broad, frankly. So we're working through those details and more to come.
Thank you very much. How about moving on a little bit to what we talked about, the financial component of this, if you don't mind, Governor. We have been focusing on adapting our practice to the new standard, right, to the new guidelines that we're establishing to ensure the safety of patients and staff. This, in combination with our offices having been essentially closed for the last 6 weeks, kind of provides a significant financial impact on our profession, just as it has on other small businesses.
Mm-hmm.
Is any consideration being given to using state funds to help those small businesses recover, the ones that have been impacted so harshly?
Well, as you probably know, and I suspect some of you already filed for the Small Business Authority loans, and I don't know how that process is going for you, but hopefully it's been as efficient as possible. There's also a couple other things to look at. The federal relief package, some of that financing is going to healthcare. And I don't have our Secretary of Finance here. I'll try to get you some more information about that. But I think the avenue that's in place currently is the the SBA loans. Dan, anything in addition to that?
I think that I think you've captured it, and we definitely would recommend that dental practices do fall into that small business category, and hope that you're taking advantage of those. Some of the other recovery and stimulus packages, they haven't really put the exact rules on how to use those, except that they need to be used for COVID-19 related elements. So that's what we'll be looking at, and we'll have more information in the days ahead.
Yeah, the dose 10:30 already.
Okay. I can stay a little bit longer if it's.
Okay. Yeah, well, we have to be done at 10:30.
We do.
Yes, sir.
Oh, okay. Elizabeth, I'm being told that we have to kind of try to wrap this up. So.
Perfect. I guess that there are a couple other questions. We will skip those, and I will just say thank you so much for your time and for taking the time to be with us in this very busy. I can see your schedule is packed. We'll look forward to everything that you will help us. We'll look forward to getting kind of some considerations of solutions to all the stuff we talked about.
Yes.
And anything that we can do for you, please let us know. We'll be happy to offer you any of our suggestions, any of the things that we've come up with to help you make your decisions in favor of dentistry.
Well, Elizabeth, thank you as well. And let's keep an open line of communication. Again, we're in this together, and we're here to help. And so if there are things that we can do, if you see that we need to act on, just don't be shy. That's why we come to work every day. So appreciate all you all are doing.
Thank you very much, and thanks for letting us. We really want to be a part of the solution. So thank you for letting us be a part of the solution.
You've all been great. Thanks. Keep it up and stay safe.
Yes, sir. You
Thank
as
you all.
well. Bye.